everyone. Thanks so much for joining me for this week's episode of When I Grew Up. On today's episode, it's my pleasure and my honor to welcome my guest, Joanne Lee. Hey, Joanne, how are you?
Hi, Blair. Thanks for having me.
Thanks for coming on and giving me your time tonight. I really appreciate it.
Absolutely. It's my pleasure to be here.
I just feel even more indebted, honestly, because I know your life a little bit. Joanne and I, we are both moms to boys that go to the same preschool. We were just talking about just mom stuff right before we started recording. And so I know you're super tired and I totally get it. So thank you again. I really appreciate it.
Of course.
So Joanne is here to tell me about her life and her journey and also her career. She is a nurse practitioner, and she happens to be a nurse practitioner at my OBGYN. But I did not know that until I met you outside of that. Right. So yeah, without, me talking too much more, we can jump right in. Joanne, what is it that you do?
So I am a nurse practitioner and I'm dual certified in family medicine, and I'm dual certified as a family nurse practitioner and a women's health nurse practitioner.
Okay. So, what does that mean? Having like dual things?
Yeah. So, as a family nurse practitioner, I can take care of patients from pediatrics to geriatrics, men, women, and a lot of different primary care setting as well as specialty settings. As a women's health nurse practitioner, I take care of women and through the lifespan, but particularly in reproductive age. Mm-hmm. And for me, currently, I work in an OBGYN. I do primarily GYN and a little bit of OB. To clarify what that means, GYN is more like women's health, like do you have vaginitis, heavy bleeding during your menses or fibroids, things like that. OB is what you think of when you're pregnant and get prenatal care at the doctor's office. So that's kind of what I do.
Oh my gosh, I'm like so embarrassed, but I did not know that.
It's okay.
I mean, I can like assume as you're talking, I'm like, oh, okay, I think this is what she means. But when you articulated it, I was like, oh, that makes sense.
Yeah. So if there's anything going on with like your reproductive organs as a woman, you come and see people like me.
Awesome. Well, I want to get into like your journey, how you started, like going to school and things like that. Mm-hmm. But before we jump into all that, I'm curious to know like what your day looks like as a NP, like going to the office and seeing patients.
Yeah. So I generally, like on a good day, like my average, I would say I have like 18 to 21 patients, which like doesn't seem like that much, but when you're talking to and trying to get to know that many people in one day, it is kind of a lot.
No, it seems like a lot. I was like, what? You see that many patients?
So, and I try my best to like remember everybody and remember their stories, but my day-to-day really, like I go to work, I check my labs or any telephone messages that I've received from patients. I look at like documents, like records or mammogram reports, biopsy reports that have been sent back to me. And then I kind of scan through my patient list. It helps me to kind of prepare for what kind of patient encounters I'll have that day. I've kind of come to a point in my practice where based on like the chief complaint or like what they're scheduled for, I can kind of anticipate like, oh, this is the kind of conversation I'll have with them, or this is probably the results that I'll need. So I kind of prep for my day that way. The kinds of patients that I usually see are like vaginitis, which is like yeast infections, bacterial vaginosis. Sometimes I see breast complaints, moms who have mastitis, or like I even had like a 18-year-old who had come in for an annual exam. We talked about doing a self-breast exam, and then a few months later, she came with like a giant lump on her breast. So sometimes I see like breast complaints, ranging from like young girls, rarely, but sometimes. And then like older women too. I do a lot of annual exams, So that includes like a clinical breast exam and a pap smear, like birth control counseling. I do a little bit of like preconception counseling here and there. Like, it's kind of wild, but you'd be surprised to know how many people out there like really don't know like how to make a baby. Like, so I do some of that. Like patients who had like irregular cycles or like really, really heavy or long cycles. I kind of talk about that as well. I would say my favorite kinds of visits are like young patients who come in for their annual exam or birth control counseling. Because I know a lot of Asian girls out there, your mom did not have the sex talk with you. So I love being the person to give the sex talk.
Yes.
And I love doing procedures like IUD insertions, your neck split-on insertions, or things of that nature. So,
why do you love it?
I like doing things with my hands,
Uh-huh.
and okay, maybe that's like sounds a little inappropriate in the context,
No, girl, this is like it could be uncomfortable for some people to hear these kind of conversations. However, I think this is what's great about you coming on is because you're not uncomfortable talking about these things. So I like it. And I think, you know, the, what's the word I'm looking for? Like the kind of like, oh my gosh, maybe this is cringy feeling. But at the same time, I'm asking these questions also because I feel like there could be people listening that's like, okay, like, I'm curious, like as a women's health MP, like what does this mean for me? And so yeah, be real, girl. Don't hide anything.
Like sometimes me and my like work friends will go out to eat lunch and stuff, and we're like talking about work, and we like totally forget like, oh yeah, maybe I shouldn't have said that so loud. Like we totally like yelled the word vagina, or like, you know, we just like. But yeah, that's and it's funny because like growing up, I grew up like super sheltered. So if you talk to my friends who've known me in my younger years, they probably would tell you that I was the last person that they would come to talk about sex with. And here I am as a women's health nurse practitioner, like really talking about sexual and reproductive health. So it's kind of ironic, but I'm like really glad that, you know, I can do this. So
yeah. So I mean, you mentioned you just like working, like doing things with your hands. I also know like on the side, outside of work, you do pottery and things like that too.
Yes,
and I know you really enjoy that, which I can't wait till you start selling it, by the way.
I don't know if I'm at a stage where I love gifting it, so we'll see.
Okay. Well, that was just a sidebar, but you know, you've mentioned it twice now, just the importance of educating women on their bodies and their health, and me myself too. Like I feel like I only know a little bit, and honestly, I don't really ask too many questions. And even like David, my husband, he's like, so do you do like your own, like, do you check your breasts and stuff? Because, you know, there's like history of breast cancer on his side of the family. And I'm like, I mean, kind of. And he's like, well, and I think it's because my mom never brought that up. I don't think she did on purpose. And these days, I know that my mom asks me to go get a mammogram, even at you know, at this age, and she talks about it more now. Like now that she's older and like realizing, as an older woman, like there are things you can prevent before it gets bad. But yeah, so like all that to say, like when girls come in. And know nothing, because I can imagine myself even in this situation, right? Getting a yeast.
I was there.
Yeah, like getting a yeast infection, right? Like so many questions. You feel like almost like you did something wrong. Oh, it's all coming out right now. Okay, like I'm like having flashbacks. Honestly, it's almost like you feel like you did something wrong, because you got sick in a private area. Oh, okay. This is like
Exactly. Yeah.
interesting.
No, exactly. Yes. And that's so like, honestly, it's that sentiment comes from like 18-year-olds to women who are 55, like,
Mm-hmm.
oh, like, because I speak Korean, I get a lot of Korean patients. And,
Mm.
because we don't really talk about sexual reproductive health in our community. And, like even things like yeast infections, they're like, oh, we're thinking like, why did I get this? Like,
Mm-hmm.
it's like, oh, why did you get a sty in your eye?
Right,
Like,
right.
are you being punished for something? No, it just happens. It's treatable. Like
Mm.
it's preventable. There's things that you shouldn't do, and there's things that you should do to
Mm-hmm.
manage these symptoms. And like,
Yeah.
I have that conversation like all day long,
Yeah.
and I and a lot of it is just like reassuring people, and a lot of it I realized in my practice has to do with how I relay that information and how I educate the patients on like treatment and things like that. Because I'm like, oh wow, you have a yeast infection versus, oh, you have a yeast infection.
Right.
Like that
Right.
completely changes how like the dynamic of how the rest of that visit goes. And I think my background as a teacher
Okay.
really, really helps in like kind of breaking things down for patients.
Yeah, yeah.
When I'm like explaining like the pathophysiology, I don't really talk to them about pathophysiology, but like where like how this like their diagnosis, like teaching them about their diagnosis and
Uh-huh,
treatment
uh-huh.
options and things like that. So yeah.
Yeah. Oh man, as you were just saying that though, it just occurred to me too, like even like as a medical professional,
Uh-huh.
like how much bedside manner like affects a patient. Cause like even you just saying that, I was like, oh, I guess like those soft skills that you need to
Yeah.
like be able to communicate and not like piss off your patient, like is so important.
Yes. 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 Yes.
Um,
Yes.
man, so like, um, I guess this might be a good time to go back to the beginning. Like,
Yeah.
if you could take me back even as far as like high school,
Uh-huh.
like did you always want to go into the medical field or what did that look like for you?
So I did. I was like, oh, I want to be a doctor. I thought I was going to be a pediatrician. And I had talked about that for like my entire life. Um, and then even in college, I graduated with biology and educational studies major. So I double majored, and
Mm-hmm.
then I went to Teach for America thinking that, oh, this is the next step for, medical school. And then during that process, actually, when I was in Teach for America, I lived with medical students and first year residents, or like first the interns, and I was like, I don't know if I can handle this lifestyle.
Mm.
Um, and like again, props to all the docs out there who like really grinded it out, and they're so knowledgeable and so skilled. But I didn't think that was going to be for me. I wanted to help people. I was really interested in, like treating people like in a medical setting, but I didn't know if I was cut out for residency and
Mm.
things like that. And my passion really was in primary care. So I never really wanted to pursue like surgery or like really anything like super like specific specialties. Um, After my time in Teach for America, I actually was trying to go to PA school. I didn't even
Okay.
know that nurse practitioners, um, I had the option of going the nurse practitioner route,
Mm-hmm.
without a nursing degree.
Oh, okay.
But the program I graduated from at Emory is like a direct entry program where I got a bachelor's and then went straight through and got my master's. Um,
Okay,
and
um you decided to do that like while you were still in school? Sorry.
So no, I graduated school and
Uh-huh.
I was a teacher.
Uh-huh.
And then I was thinking about applying to PA school. So I had
Uh-huh.
to get clinical hours. And so
Uh-huh.
I was working as a medical assistant actually in the clinic that I work at now.
Oh, that's right. You told me that. I
Yeah,
forgot
yeah.
about that. Yeah.
Um, and then um, and then during that process, I found out that there was a program where I could get a bachelor's of science and a
And
master's. Yeah, like without having to reapply to master's program,
I see.
which
Okay,
was
okay.
super helpful for me because I didn't have a bachelor's in science of nursing, like a BSN.
So you do
Um,
need that though.
you do need it. You
Okay,
do need
okay.
it. So like Selena, who was on here previously, she had her bachelor's and then she was working as a nurse, like a
Mm-hmm.
bedside nurse as an RN, and
Mm-hmm.
then went back and got her master's.
That's right.
So I just went straight through without
Gotcha.
the working as a bedside nurse part. I got all the, I had the, I think Selena touched on it previously, but the nursing model is a little bit different from the medical model.
Mm-hmm. Mm-hmm.
So I was more trained with like a nursing background.
Mm-hmm.
I did rotation in bedside nursing. I passed the NCLEX, and then I did my master's program. And the master's portion is when you pick your certification, whether you want to be a family nurse practitioner or women's health nurse practitioner. And I actually chose to do both because honestly, I wasn't sure when I was going to be sick of looking at boobies and vaginas all day.
Yeah.
So, so I was like, I am obviously like I had a double major in college. I like switched my careers a bunch of times already.
Mm-hmm.
And so I just wanted to keep my options open and see like what else am I going to be curious about in like 5-10 years, you know?
Yeah.
And then as a nurse practitioner with a certification as a family nurse practitioner as well, I can switch. Like I don't have to go back to school to get recertified. I can just find a job and then like even as a women's health nurse practitioner, a lot of my training really came from studying that I did while I was on the job. Like once I got to the practice that I'm at, and I'm going to echo a lot of things Selena said here, but she was like, I am the forever learner. And like, that's exactly who I am. Like, I love learning more about my field now, but then I always get an itch like, man, dermatology would be super interesting too. Like I saw this weird thing on somebody else's vulva. I wonder what it is. I wonder if I go into dermatology, I'll know more about it. And so I I'm like curious about a lot of things.
Yeah.
And so I think that's what led me to do both so that I had options in the future.
Wow, that's amazing. Yeah. Not a life that I could really journey through, but however, so much props to you. I should have asked you this in the beginning, but for the people that like you mentioned before, Selena was on and she's also an MP. But for people that didn't listen to her episode and don't know, how is an MP different from an MD? Like a doctor.
So MDs, they go to medical school, which is like 4 years. And then they pass different standardized tests throughout medical school.
Okay.
So 4 years of just medical school is already longer than the whole program that I went through, getting my BSN and my master's in nursing.
Wow.
And then they have to go to residency, and the path for residency is you have to match, right? So you apply to certain programs for residencies, but they also have to pick you. And then on this wonderful match day, you like open up the envelope to see. It's basically like professional Tinder or like Hinge or whatever, like dating apps, because you have to like them, but they also have to like you, and you have to match. But then you can't really choose. Like if you matched in, like I had a friend who matched in Wichita, Kansas. Like she like had the choice to apply for that program, but whether they chose her back or not was not up to her. And then she matched. And so she was in Wichita, Kansas for 4 years.
I guess because you don't have
for
the
residency.
luxury of like saying no. If you
Right.
match, you match.
Yeah,
So
you match. So, and that whole process is an extremely rigorous process. So again, like 4 years of medical school, 4 years of, I mean, the residencies can range in length and programs. So I don't actually know a ton about like the details of the medical program route, but for nurse practitioners, the program that I did the Bachelor's of Science in Nursing. I passed the NCLEX, that's the standardized test for nurses. That's when, and then I got my bachelor's, like BSN.
Okay.
That's the Bachelor's of Science in Nursing. And then during my master's program, we do like more studying, but it's similar in that we learn diseases, treatments, assessments, how to diagnose, things like that. But we don't have like a residency program afterwards.
Okay.
We do rotations we do clinical rotations while we're in the master's program. And for me, I got really, really lucky. It was like, because I'm such a nerd and I'm curious about everything, I did rotations in pediatrics, geriatrics, urology, endocrinology, OBGYN, like literally urogynecology, like neurology. I had so many different things that I learned. So I really enjoyed that process.
Yeah.
And I think for medical students that happens too. But once you get into residency, you're like deep dive into just one thing. But my master's program, I got to do a little bit of everything. Yeah.
No, sorry, I didn't mean to cut you off, but
No.
I guess, were you going to say more before I ask you the next question?
I wonder if you're going to ask the question. Okay, just ask the question so that I can answer it and not like assume. Yeah.
I guess what I was going to ask was like, is seeing an NP the same as seeing my doctor?
So that's a really good question. Yes and no.
Okay.
Annuals, vaginitis, things like that. Yes. Like what the physicians at our practice would do is probably the same thing I'm going to do. Like every provider has their preferred medication or preferred like birth control pill that they like to prescribe. Okay. And it's really based on their training. Even with MDs, based on their training, their preference of how they treat and diagnose will be different from the next doctor. Some people are a little bit more conservative, and some people are more like, more not aggressive, but more like straightforward. And they're like let's do this kind of like surgeries, for example.
Okay.
For me, what I really like about my job is I want to know about everything, but I don't want to like always be the responsible like end all be all. I have no problem relinquishing that power. And so I often like if I'm going to make a sports analogy, like I'm into sports, but I'm not. Okay. So it's like when when the basketball player is like going for the dunk, right? There's like somebody like passes them the ball to assist, right? I'm kind of that role.
Okay.
So somebody comes in, for example, like if you have really heavy bleeding and you want your evaluation, like you want to start getting the evaluation going, I take a really detailed history. I talk about management options. I talk about like what's next step in terms of evaluation. But if it's like prescriptions or something like that, I can totally do that. But if it's a surgical procedure that's necessary, I cannot do that.
Okay.
So if it gets any more complicated than what I'm able to handle, then I always have a physician that I can say, hey, see this person next because they can talk to you about all these treatment options, including surgeries.
Okay.
So for like annual exams and things like that, I'm very confident that the service that like the visit that you would be getting with me would be very similar to what you get with a physician. But if you needed surgery, I am not the person. And I will be the first person to say like, hey, I don't know. So
Yeah,
let me
yeah.
go ask and then see what's best for you next. And, and I try my best to make sure that their visit is not wasted by making sure that I take a really, really good history, because that's half of the visit, right?
Yeah,
Like
yeah.
half of the visit is, why are you here? What other health conditions do you have going on? So I get to know that patient really, really well, so that when the physician sees them, they can say, this is least invasive to most invasive options that we can go. So that's kind of the difference in like how my practice is set.
Gotcha.
Yeah.
Do you ever okay, where I'm coming from is this.
Yeah.
I actually asked your coworker Mimi
Yeah.
Song
Yeah.
a similar question.
Uh-huh.
I think even myself, right? Like
Uh-huh.
when I was delivering my babies, when they asked me if I wanted to see a midwife or an
Uh-huh.
NP, and
Yeah.
honestly, when I was delivering my babies, Zoe was the only one I delivered at Modern, but
Mhm.
during that time, yeah, like I said, there weren't that many midwives or NPs on
Yeah.
actually. It
Yeah.
was
Yeah.
only like,
Now there are a
yeah,
lot.
like at the
Mhm.
time there was maybe like all four or five doctors, and then one
One or two, right?
midwife or something like that,
Uh-huh.
right?
Uh-huh. Uh-huh.
But I
Uh-huh.
remember like things were getting busy at the office, and they would ask me like, do I want to see the midwife? And I said,
Yeah.
no, I'll just see a doctor. And I, after talking to Mimi, honestly, I was like, oh,
Yeah.
like that was silly. Like, I don't know why I
Yeah.
did
Yeah.
that.
Yeah. Yeah.
But do you ever like feel that kind of tension when you see patients, or do they
All the
request you,
time.
or?
So now that I've been at my practice for a while,
Mhm.
I am seeing like a lot of my annuals who request specifically to see me,
Right,
which
right.
to me is like, oh, they've had a good experience seeing
Mhm.
me. There was nothing too complicated about them where I had to have them see one of our physicians or
Mhm.
something like that. But I get that all the time. I straight up had a patient who like paid her copay, got her vitals checked in, everything. She was sitting in the room. And then I walk in and I'm like, hi, I'm Joanne. I'm the nurse practitioner. And she was like, excuse me? Like, you're not a doctor. And I'm like, no, I'm a nurse practitioner. Like, and this is just for an annual exam.
Yeah, yeah.
Do you want to see a doctor? And she's like, yes. And I was like, well, that's not me. We can reschedule your appointment if you would like. And she's like, yes, please. I'm like, all right, see ya. Because what am I going to do? I'm not going to go to med school just so I can go see her.
Right.
It happens all the time. And I don't take offense to it.
Uh-huh.
They just haven't given nurse practitioners like myself an opportunity to show them the quality care that we can provide. So I don't take offense to that. A lot of times it's really hard with Korean patients because the concept of nurse practitioner just doesn't exist. Like, I literally don't have a word to explain my job in Korean. So like I've heard like, oh, 수간호사예요, which is like chief nurse. And I was like, no, that's more in like a hospital setting.
Right.
I
mean, that's different. No. Like a chief nurse is totally different than being a nurse practitioner.
Yeah, exactly.
Like, schooling is different. Everything is different.
Yeah. Is different. Yeah. So it's hard because I literally don't have the vocabulary to describe to them what my position is. But yeah, so
it's fascinating.
Yeah.
No, because like I
don't take offense.
And I guess I was just genuinely curious how it makes you feel as after years of studying, the effort that's been put in, and also like people just like needing help and you're offering it.
Yeah.
And so it's like, what's the problem here? But again, I will say that I personally, I think I have felt that as a patient myself.
Yeah.
And now that I'm educated on the
Yeah.
matter, I feel much better about it.
Yeah.
But Joanne, so like I just recall you telling me about
Uh-huh.
your master's program and just
Uh-huh.
like you getting pregnant and stuff. Like,
Yeah.
would you mind telling us about it? Because I just feel like that just adds one more superpower to who Joanne Lee is, like going through your master's program while pregnant and about to
Yes.
deliver. It's from what I remember, but I want to know the whole story.
Yeah. So actually, I really wanted to say, like, when you asked me, like, what was my job, I wanted to include mom, right? Because being a
Yeah.
mom is super important to me. I mean, so as a wife, hey, James. Um, but like, I feel like in terms of like work that I do, I think being a nurse practitioner is my career, but like being a mom is my vocation, right? Like been called to be a mom. So I found out I was pregnant a week before my program started. I bawled like a kid. Like I was like, I was not excited. Needless to say, like, obviously I stuck at my job. This is before school started, but I was a surprise, a wonderful surprise. But I went through school with terrible morning sickness. The first Foley catheter I did was when I was like puking every other hour.
Oh my
I'm like a really,
gosh.
really old man. I was like, ah. And then my water broke preterm in my second semester of school.
Okay, so let's clarify what this means.
Yes.
Your water breaking preterm means it
Yeah.
broke early and
Yes.
not at
Before
the.
baby was ready
So
to
how
be
many
delivered.
weeks was that?
It was like 30 weeks. So full term
Full term is 40 weeks,
gestation.
people.
Yeah, exactly. Exactly. So 40 weeks is when your due date is. 37 weeks is actually considered full term.
Okay.
But if you think about like 9 months is how long it takes to make a baby, like a human, and how rapidly things change and like from week to week. Those weeks were like pretty critical. So I was walking to my pharmacology exam. And I just like felt a trickle and I called my husband like crying, like, I think my water broke. It was like 9 a.m. at Emory. The traffic is terrible. I'm like walking to an exam. Like I didn't know what to do. We had a friend who was getting his PhD at Emory. So he ran, got my car, drove me to my doctor's office. I was like calling the doctor's office, like, hey, I think my water broke. And they're like, are you sure you didn't urinate? And I was like, I am a nursing student. I know where my bodily fluids are coming from. Like, I know it is not urine. And so I went, it was my water. I was hospitalized in the antenatal high risk pregnancy unit for 3 weeks. I was on bed rest. Yeah. So for almost 4 weeks, I was on bed rest. During that time, I still had schoolwork. So in the hospital, one of my professors wanted me to do a presentation, and I was like, I can't do that. Like I don't know when they're going to walk in to, get my vitals or draw blood. I don't know what they're going to do. And one of my professors brought me exams. So I took like 3 exams while I was on bed rest. And then Isaiah was born, and then he was in the NICU for 2 weeks. And then after that, I had to finish off the semester. So when he was like 4 or 5 weeks, I finished up and took like 4 finals. After that.
Goodness. And so this is your what year? Like
this is in my BSN portion, so my bachelor's portion.
And so you went and finished your master's with Isaiah?
Yeah, I did.
And you finished it on time?
Yes.
Okay.
Yeah,
how?
I did.
How?
My wonderful husband and my mom was living with us at the time. So they put in so much work to get me through school. So for my clinical rotations in my BSN program, I had like 12-hour shifts. So I was doing like 12 hours, and literally James was coming home after work to help my mom with the baby. And honestly, it's kind of all a blur. Like, I don't think I would have survived it with my friends from nursing school and my church community. Like, during the time I was in the hospital, we were the party room because everyone always came and visited our room and like hung out with me. And so I don't know how moms are doing it during COVID times where they can't have visitors. I just felt so loved and supported during like one of the most challenging and difficult times in our lives. And I am still so grateful for all the friends and family who were with us during that time, because I think about it now and like it kind of sucked. Like I had like trauma after coming home from the hospital because we had a humidifier in the room. And after we brought Isaiah home, we turned on the humidifier. And I started bawling uncontrollably because I had a flashback back to the hospital room because I was in the hospital for a month. So like it was pretty difficult, but I didn't realize how hard that was for me until that incident happened. I was like, oh my God, that was really stressful.
Yeah. Oh my God, I'm trying not to cry right now.
But I really it's really one of the times that I felt the most loved and cared for, really.
That's amazing.
So yeah. And now in Isaiah, because, like Tegyo, you know how Korean people do Tegyo? I always joke like, oh, he got a nursing degree in the womb,
Yeah. Oh my goodness.
Yeah.
That's insane. I mean, I had no clue. I mean, you mentioned like here and there in conversation, but I didn't realize like you were mommying while you were getting your master's.
I was totally mommying. And then in my master's program, the last semester of my master's program, we got pregnant with our second kiddo. And I have terrible morning sickness. So I literally remember pulling over on the side of 400 and then just like puking out the door of my, like the passenger seat, because all the cars were driving in the driver's seat, like driver's side. So I like threw my body over onto the other side and like puked out 400. And then Zion was born in April, and I took both of my boards in February.
Oh my God.
So these kids, like they didn't get the classical music and like, meditating mom kind of figure. They got like stressful studying. Isaiah, I had brought home like the IUD insertion practice kit, and Isaiah would like walk around with it and go like, I'm fishing. I'm like, that is a contraceptive device.
Oh my gosh.
Yeah.
No, I mean, I'm just sitting here like trying to imagine myself in your position. I too, like my morning sickness with both kids was like horrible, like horrid. And I can't even imagine like you talking about it, like just morning sickness in general, like it's making my hands sweat right now.
Right?
And then on top of that, like studying, like focus studying, no, it's not, you're not like just in high school here. You're like not messing around. So, I mean, my question is at this point is like, how did you keep going? I think it would have been easy to be like, it's okay. It's okay. You know what I mean? Like, I'll just pick up later, or I don't know, like what made you keep going?
Honestly, I didn't even give myself an option. Like now that you're asking me that question, I didn't know I had a choice. I was
yeah.
I'm just gonna do school. Like school needs to get done. Like I don't even think I paused to consider like taking time off from school.
Yeah.
but yeah, like now that I am a mom and have been working and like, I can't imagine being pregnant, like working. I'm actually so grateful I did that in school.
Right, right.
Yeah. Because
Yeah.
I studied when I could, like, but when you work, like, I can't be like, oh, can you come see me as a patient at like 8 p.m. because that's when my baby goes out. You know, like, but
Right.
studying, I could be like,
Yes.
baby's napping, time to hit the book. And so I think it was really a blessing in disguise for me because being a mom was so, like, I really knew that I wanted to be a mom. And then my career was also so important. Ironically, I joked about this with you before, but I deal with boobies and vaginas at work and I deal with penises at home,
Yes.
you know? So, but I love being a boy mom. And one of the things that like kept me going is I still, even now, feel so much mom guilt for not always being able to be here for my kids. But when I'm at work, I really feel so fulfilled and I really feel like this is important to me as like an individual, like outside of my mom hat. It's so important to me as a person to have a career that I feel like I'm giving back and is, you know, like worthwhile, you know? I really think that it makes me a better mom at home. So when I'm at home, I want to go back to work.
Yeah.
And when I'm at work, I'm like, oh, I miss my kids.
Yeah, of course.
But I really think that surrounding myself with a lot of women who also balance home life and career, they can relate. So we might not all have the right answers, and the grass may always seem greener on the other side.
Yeah.
But I think just having a community, like I have a group of mom friends who some of them work and some of them are stay-at-home moms. And I think it's so amazing that I have that to like keep my perspective in check, you know?
Yeah. Yeah.
So that is really important to me. And I don't think I'm doing it perfectly, but I'm glad that I actually have the opportunity to be able to do it. Because I don't know that everyone has an option to, like, I grew up in a single parent family. And so my mom didn't have an option to be a stay-at-home mom.
Right.
But I get to do both. And I do think it's a privilege. And I think, like, you know, I think being a women's health nurse practitioner and being an advocate of women, I want to really like applaud all women for the choices that they make for themselves and for their family, because none of it is easy.
Yeah.
Like none of it is easy. So, yeah, like I just think that if I could go back and tell my 18-year-old self, like, you can actually do either or both, but it's still hard. You're just going to have to decide which, like, pick your poison and pick the joys that you want to come to, like, to be able to enjoy, because you can have it all. It's just really hard.
Yeah, I mean, I love everything that you're saying right now. And honestly, I don't really have a strong opinion on either. I feel the same way as you. I think what I love that you said just now was like when you are at work, you do feel fulfilled, and that is purposeful. And I know that you and I, we both of us share in our faith, and even in that, right, in that perspective, I feel like you can't ignore, you know, the giftings that have been given to you, and also the blessings in your life. And for us, that looks like our family, right? And so, but at the same time, right, it's like it's all a privilege. Like even me, like stay at home, like what you just said, right? Like I can have a lot of opinions about being a stay-at-home mom.
Yeah.
And or even like for those that are working moms, right? I could even argue like, oh, well, you know, this is why I feel like stay-at-home moms are important. However, I totally get that what I do, like, is a privilege. Like it's a
Uh-huh.
luxury, you know? And
Yeah.
so
Yeah. Yeah. Yeah.
and then I'm like, oh man, the grass is greener, isn't it? You know, and I look at your life, I'm like, yes, like I want that. I want to feel fulfilled.
I, it's not every day though. Honestly, sometimes I
Yeah.
come home from work and I'm like, I just saw a lot of yeast infections
Yeah.
today, you know? Like it's not always like, oh my gosh, I helped women
Right.
be healthy and educated them on preventative health. Like it's not that. Like the one or two patients that feed that for me is what does it. But sometimes I just come home like after a lot of yeast infections. So,
Yeah.
you know,
Yeah. I mean,
but
work is
yeah,
work, right? Like work
work
is
is work.
work.
Yeah, work is work.
And mom is mom, but mom is a
Mom is
full-time
mom.
thing,
Yeah,
working or
yeah,
not.
yeah.
So
I can't clock out. So,
yeah,
yeah.
absolutely. But yeah, I really appreciate like what you said just now. And I feel like even what you said about like people making decisions, like women specifically making decisions
Yeah.
for their life. And
Yeah.
it's not always just black and white. And I bring
It's
this up
not.
because you and I, over Mother's Day weekend, had a conversation about
Yeah.
Roe v. Wade and the choices
Yeah.
that people are
Yeah.
making over women's body or
Yeah.
the lack thereof of a choice.
Yeah.
And I remember just like sharing in this conversation with you and not really knowing how I felt about it.
Yeah. Yeah.
I think that growing up, I heard one thing one way in my house,
Uh-huh.
just from a conservative background.
Yeah.
And I think hearing your like kind of how you feel about it as a
Mm-hmm.
women's health practitioner, and even Mimi was there too,
Yeah.
kind of just hearing her side as
Yeah.
well. It was extremely enlightening for me,
Yeah.
and I realized like things are not always just black and white, right? Like
No, no.
pro-life, pro-choice is not
Yeah.
clear all the time. I
Yeah.
did. Okay, actually, before I say this, would
Uh-huh.
you mind kind of elaborating on maybe what I'm talking about right now? Is that possible? I don't know if you
Yeah.
can, but
I'll keep it as vague
yeah, keep
as
it vague.
possible. Yeah. So, like for example, when patients who have had unexpected pregnancies,
Mm-hmm.
um, like who are later in life and have a lot of comorbid risk factors,
Yeah.
their pregnancy is pretty risky.
Mm.
So, meaning we're not sure what maternal and fetal outcomes will be,
Mm-hmm,
right?
mm-hmm.
And there was this one particular mom who already had 3 children, and she had an unexpected pregnancy. Her prior pregnancies are high risk, but she had recently been diagnosed with like brain aneurysm. And this next pregnancy was going to be even more risky.
Mm.
And so what really tugged at my heartstrings with this mom, because she also shared in her faith and was like, I don't want to terminate this pregnancy,
Mm-hmm.
but I also want to be here for the babies that I already have.
Mm.
And that just really, really tugged at my heartstrings, because for me, like I cannot imagine the thought of me making a choice to potentially leave my children,
Right.
like not be here,
Right.
like potentially risk my life and my kids not having a mom. Like even the thought of it, like I could cry right now.
Mm.
But she was having to make such a difficult decision. And who can blame her for that? Can you really say like, oh, then you shouldn't have sex then? Or didn't you know how babies are made? Like
right.
because she had all these other comorbidities, like there were a lot of different birth control options that were not good for her, like
Mm-hmm.
that she was not a candidate for. So can I knock her for that? No. Can I knock her for getting pregnant? No. Can I like judge her for wanting to be here for the children that she has and potentially risking her life for a child that was unexpected.
Right.
Like, whose life is more precious?
Yeah.
I don't know.
Yeah.
Who's to decide? The Supreme Court? Like, can you really say, like, actually, that embryo made of 32 cells right now is more important than your life because you had sex? I mean, to me, as a healthcare provider in those situations, and I grew up Christian, I grew up in a very conservative Presbyterian household. My uncles are all pastors. I don't know that they would agree with me, but and I really don't like to make political statements. So this is not all of my political beliefs or anything like that. But really, this particular patient stuck out to me, and it was a difficult conversation to have. And all I could say in that situation was, I'm sorry you have such a difficult decision to make. You know, like, I can't make a decision for you.
Right.
Like, I can't tell you not to terminate your pregnancy, and I can't tell you to terminate your pregnancy. You know, I just have to tell you, like, I'm sorry. That's such a hard place to be in. And all I could do was empathize with her.
Man, that's crazy. That's so crazy.
Yeah. So, I mean, I think that's one of the challenges. Like, there's a lot of moral and ethical things that we don't deal with all the time, but when we do come across it, is very challenging in my professional setting, because there's no right or wrong answer.
Right.
Yeah.
Man, it's like, it's so hard to, and like, I had time to process things a little bit, and even just like ask God about it, because it's like, my thought process goes like this, right? It's like, okay, if I believe in the sovereignty of God, right? And then I believe that everything happens for a reason, then am I to believe that, say, take this situation, for example, right? Like, okay, if God gives us what we can handle, right? What is this? Like, it's like,
where's the line?
Yeah. And like, it's like, like, okay, do I just trust that this baby is here for a reason and I will survive this? But then what if, like,
what if you don't?
What if I don't?
Yeah.
And then like, but anyways, it's like, I was like, okay, I have to stop thinking about this.
It goes into you go into a rabbit hole.
Yeah.
Have an answer. Like, it's hard you can have an opinion.
Right.
But honestly, like, if you really were in those shoes, like, could you judge her for making a decision either which way?
No.
Like, there's no way that you can. Like, and I think it may be a little bit easier to be quick to judge if you're not a mom.
Yes, I was just you took the words right out of my mouth.
Yeah.
Like, I can honestly, I think I can only resonate with the situation because I'm a mom myself. Yeah.
And she has 3 kids.
It's crazy.
Like,
yeah.
And could you, I mean, it's hard. It's hard. I don't run into these dilemmas regularly, which is why I have such a hard time.
Yeah.
Like, on what is the wisest way to handle the situation.
Right. Yeah.
Because, but I think, you were saying, like, those soft skills of being able to empathize with those patients, it really makes a difference in how people feel cared for, right? And I could just throw prescriptions at them, or I can really, like, listen to their story. And I think I love the part of getting to know their story.
Yeah. I was just going to ask you, like, what do you love most about being a nurse practitioner? And I feel like I would enjoy that the most, but would you say that's it?
Yeah, I really do like getting to know people. I really like getting to know people. Like, I don't like OB because I have to see them frequently. But, like, annual exams, or, like, once in a while, I get to catch glimpses of their lives. And I have, like, my favorite is my young patients. So I had a patient who was just starting off her freshman year, and she's now like a junior about to get into her senior year. And we have gotten to know each other so well. And she'll come see me like during her breaks. Like she won't go to an OBGYN near her school. She'll come back and schedule her appointments during her breaks.
Oh my goodness.
So things like that, the relationships that I develop with patients, I really love, especially my young patients, because one, I get to teach them in advance about things to expect and how to take care of your body, how to prevent things, what to do if something feels off. I love that part. I love getting to know patients. Hardest part is those like moral, ethical dilemmas and patients who either misinterpret or misunderstand the type of care that I'm trying to provide, and kind of misunderstand my intentions of wanting to provide care. Patients can get snippy, so that's kind of hard to deal with. But I really think being a former 8th grade teacher, I'm like, I have dealt with, prepubescent boys and girls. Nothing scares me.
Yeah, you're prepared for this world. Yeah. I guess that even segues into my next question. I was going to ask you, what do you like least about your job? Is it that?
Yeah, that is
snippy patients.
Hard.
Yes.
Yeah,
no one likes rude people, but
no. Sometimes I think it's because this is what I think is best, and they'll come at me at a different angle, like I was out to get them when I really wasn't. So just the misunderstandings like that make it really challenging, difficult patients.
Yeah, I'm sure. Was this OBGYN office your first job out of your master's program?
It wasn't. It's my second one. Yeah. And I am very happy where I am. You can fill out the lines,
Yes. Okay.
Yeah.
Oh.
Yeah.
Okay, I just remembered.
Yeah. I was working, my first job was in a very, very challenging environment, very challenging. Because it was primarily Medicaid patients, and there were a lot of social things involved, and it was the patient education was so difficult because of the patient population. So I just felt as a new nurse practitioner, I had nothing to offer my patients who needed the most care.
I see.
And it's kind of I know we didn't talk about it, but Teach for America is where they take teachers with leadership skills and place them into Title I or either urban or rural schools with higher needs.
Okay.
And then they train them and then place them into the classrooms and teach those students. And that really did have a really big impact on why I decided to leave that prior practice, because I was I know that this patient population needs a really good provider, and I'm not there yet. I need to gain experience somewhere else so that when I come back to this particular patient population, I can have more to offer them. And I can have more experiences to draw from. But right now I need a place where I have more support. I have more colleagues to, bounce ideas off of. I need more, physicians who are willing to teach me. And that just wasn't the environment that I was getting previously. And I definitely am getting that now.
Wow.
And so eventually when I feel like I'm, a little less green and I'm a little more seasoned, I hope to be working in a population with higher needs. I don't know that I'm there yet.
Yeah. Yeah. No, I
Yeah.
mean, that's really tough. And I feel like
Yeah.
I thank you for your transparency and explaining all that, because
Mhm.
I think it makes me think of like imposter syndrome a little bit, like just
Oh,
kind of
absolutely.
faking it till you make it, but you're not
Yeah.
like in, and I think, wow, so good on you that you were like, hey, you know what, I need more skills. I need more
Yeah.
training. I
Yeah.
can't like figure this out. I mean, again, these are
Yeah.
people's lives that you're dealing with too. So,
Exactly. Yeah.
yeah, that's amazing. That's
Yeah.
so great. I usually ask people
Uh-huh.
at the end of the podcast, or
Yeah.
heading towards the end of our podcast
Uh-huh.
together, um, if you have any advice, like advice for somebody that's thinking about going this route of being a nurse
Mhm.
practitioner, or any just life advice at all.
Um, I was waiting for you to ask me this.
Yes.
um, so like I've had um U-turn after U-turn after U-turn in my career path. And
Mm,
I really, if I could go back to my high school self, I would want to tell myself, like, the person that you think you want to be at 18 or in high school, it does not need to be the person that you become when you're in your 30s. Like,
mm,
that trajectory could look totally different, and that's okay. Like,
mm-hmm.
that's still okay. Even now, as a nurse practitioner, like listening to your podcast, I'm like, man, what else would I be good at? Like, what's my next step? And so I think that it's okay to take a totally different path. And most of the guests that you've had on your podcast, I think, have echoed that for
Yes.
sure. Yeah.
Yes.
Um, and then on a personal level, I really thought that my career was who I was going to be. But I think it took being a mom and being a wife and being like in the professional field um, to teach myself, like, hey, like you need to find something that, whether in your professional life, in your personal life, that fulfills you and brings you joy. Like for me, that like spending time with my husband and my kids, and that really is part of who I am outside of my work. And when I'm at work, it allows me to be fully present at work.
Mm.
But like, figure out what else you're good at. Like, I love pottery, and I pretend like I like golf and stuff, but really having
What's up,
like
James?
having but having outlet for myself, again, is a luxury and is a privilege, but it's so necessary. And I felt like I identified as a nerd, and like that had to be who I was. But
Mm.
it really didn't like, now I see why like all those college applications were like, oh, we want a well-rounded person, because like square people like who I was at 18, like don't really get far. There's like a you hit a roadblock. You have to be well-rounded in the sense that you have to do things that in different areas of your life also fulfill you. So like it's kind of ironic to say in a podcast that's talking about careers, but focus on your life outside of your career too. I think that's super important.
No, yeah, I think you're definitely not the first person to say that. And I love
Yeah.
that everybody says that, because
Yeah.
I think, in particular, I'm sure you've noticed I only interview Asian Americans with the
Mm-hmm.
purpose of like, there's something to that, right? Like in the
Yeah.
culture that we share, and
Yeah.
needing this permission, right? Like,
Right.
it doesn't have to look this way, even
Yeah.
though our family, whether they said it, articulated it or not, it's
Mm-hmm.
like just kind of ingrained in our DNA, I feel,
Yeah.
right? To
Yeah.
to feel this need to decide
Mm-hmm.
and just keep moving forward and
Mm-hmm.
not make mistakes on the way,
Yeah.
right?
Yeah. Yeah.
And so I appreciate you even just saying that, because
Yeah.
I honestly, like, I share in what you were saying. very square, not a very like well-rounded person. I want to be. I want my children to be. I'm doing everything I can
Yeah.
to make that happen for them. But yeah, and it's not like we do it. I feel like I didn't do it on purpose. I think,
Yeah. No.
but no one gave me permission to be anything else.
Yeah. But also like I think in our generation, I might be speaking like more broadly, but I'm second gen. So my parents immigrated from here. They didn't really have the luxury to enjoy things outside of work,
That's
right?
right.
So I don't think it was ever articulated to me that this needs to be everything, but it was demonstrated to me.
That's right.
Like,
Yeah.
and I think that like that word that you chose, I need permission, was because it was demonstrated. Like I never saw anyone who like was not like constantly career focused, and you know what I mean? Like I never like that was never modeled for me. And so I think that's kind of where that comes from, where I think it's so important, where we can say it like, yeah, go have fun.
Yeah.
Like, yeah. Oh, you don't want to study right now? Okay, just go have fun. Like
yeah.
Obviously there's a balance, and as a parent, it's so hard to find that balance. But like, you and I have talked about it. Like, I don't want Isaiah to be like, I need to study. Like,
right. It's not about the high test score, y'all.
Yeah. And like, this is where I so appreciate my husband, because my husband thinks I'm such a nerd. Like, he's like, I can't believe like you went. So I have 3 separate degrees from Emory.
Oh
so,
my gosh.
Because I got
right.
my bachelor's in nursing and master's, and you're like, I can't believe you want to go back to school. Because I had like talked about maybe I'll go for a PhD or a DNP. He's like, you want to go back, like another one? And I was like, I'm just like, messing with the idea. But he's the kind that would calculate like what do I need to pass this class? And he would say like, do I need to do this assignment class? Nah, I could get by. I mean, like that thought never occurred to me. Like, like that thought never occurred to me. But I'm like, yeah, like why did I need that A in pharmacology, in cardiac medicine that I never used in my daily practice? Like it just never occurred to me. But anyway, I digress.
Yeah.
So I think you need to be a well-balanced person.
Yes,
I appreciate my husband for unnerving me a little bit.
Well, it's so just again a sidebar. As you were talking about your husband James, I forgot to mention James and I went to high school together. We're a grade apart, but like he was in like from what? Okay, correct me if I'm wrong. And he may listen to this and be like, "That's so not true." But what I remember is like, I mean, he was in the AP classes and honors classes. But what you said just now, I'm like. Yeah, that sounds like James. Like, but then I mean, he's a businessman now too, right?
Yeah.
So he's very cunning in that way. And I feel like that I too never thought like that. I remember going into college and getting my first C or D or something. And I was like, the freak just happened. Like, I studied my hardest and I felt like it was the end of the world. So like I too am like that. So
and it's funny because now he's a businessman and I obviously am not. I'm like money. I put all my eggs in one basket. And if I drop that basket, it is the end. I have no more eggs.
Yes.
Will be like, I'm going to reallocate this one. Like he's so good at like allocating his resources in appropriate ways.
Yeah.
Where he can, like I want my kids to be like my husband because he's way more well balanced than I am. But yeah.
No, thank God for a husband. Seriously.
I know. I know. I don't want my kids to be like me. It's hard. It's hard.
Yes. Oh no.
So
they need to be a little like you. Because you're pretty awesome.
I think I'd be too. Well, thanks.
Oh, man. Well, Joanne, thank you again so much for your time tonight. I learned so much about your career and just even like just being transparent with all of it and even being like just knowing more about women's health. I think men should
Yeah.
know about women's health too, honestly.
Yes. Guys, men, if you have questions about like normal breasts, vaginas, all that stuff, if STDs, I'm your girl. Let me know.
Oh man, you heard
In
it
an
right
appropriate
here.
way.
Yeah, of course, of course.
And it will be appropriate and in medical setting, you know.
It's all G-rated things, and but yes, you heard it here. Joanne just offered her help. Whether you're a male or a female, and again, strictly professional, obviously.
Yes.
But if anyone has questions about nurse practitioning too, would you be open to talking to them? Sorry to put you on the spot, but
yeah, absolutely. And also, men can be women's health nurse practitioners too. Just saying.
Oh, I am so dumb. I don't even think of that.
Yeah.
Why not?
Yeah, of course. Mm-hmm.
Okay, well that's for another podcast.
Anyway,
but...
yeah. I will find a male women's health nurse practitioner for you.
Yes, that would be amazing, actually. That would be so great. Well, guys, if you have any questions about the podcast or you just feel like reaching out, sharing with me what you thought about this episode, feel free to DM me through social media, or you can email me at podcastwigu@gmail.com. Thanks again, guys. Until next time. Bye. Bye, Joanne.
Bye.